This is the update for today with regard to COVID-19 status, 27th May 2021. The number of new cases today is 809. The number of recoveries is 597. The total number of active cases is 8,255. Out of this, 4,214 are in East Kast Hills, 1,225 are in Ribhoi district. The total number of deaths is 12, 11 in East Kast Hills district and 1 in West Jaintia Hills district.
One decision we taken today is relating to the coverage and benefits extended through MHIS for those patients or beneficiaries who enroll themselves under this special scheme. After due deliberation, today we decided, for example, what happened was till today, the entitlement of one beneficiary who enrolled themselves under MHIS, when they admitted to hospital in the ICU, the existing rate was about 4,900 rupees per day. And as I said to you, we discussed today with the dedicated teams of MHIS and with the entire health department. I'm so thankful to inform to all of you that the government, as proposed by the health department under this special mission, we will increase the coverage from 4,900 per day up to the maximum of 60,000. Do you get the point? From 4,900, the coverage of MHIS to those registered patients will be up to 60,000 rupees. And this decision is taken on the basis of immediate relief to be extended to the concerned beneficiaries. Because the enrollment till today done by the beneficiaries covered only up to 58.5%. You may ask the question, why it happened so? I'm just telling you the problem is the remaining percentage out of 58.5 to the reason best known by them. I don't know what happened, they did not come up for enrollment or for registration. So I would therefore urge all the citizens of the state who are eligible to enroll and to register themselves under this important scheme to kindly come forward, register and enroll yourself so that the benefits can be extended to all of you. After again getting all the inputs, the recommendation from the department, from health department, I am again happy to inform that the government has taken a decision today that from 1st April 2021, this year, those deceased who have lost their life in different parts of the state out of the COVID-19, government will extend ex gratia amount of rupees 50,000 per deceased. This will take effective, as I've already told you, from 1st April 2021. And we really spent a lot last year. So taking into consideration the impact that we have this year, it's so huge. It really affects mentally to each and every citizen of the state. So therefore, why we decided to extend the ex gratia help to those families who has to go through all these painful memories in their life. That's why, as a token, we decided that we will extend with effect from 1st April 2021. The process is very simple. Now we are going to issue notification by tonight itself. Notification will come out, and we authorize the district administration, deputy commissioner, along with the DMHO. Then they will identify those deceased, and then even the names of the immediate family of deceased, and again DC will send it to the government for sanction, and then the check will be transferred again to the deputy commissioner, and the deputy commissioner will hand over to the deceased family. I think I've seen in the newspaper where the statement says that the prefab building for creation or for establishing of corona health facility in the state is not appropriate. I think, if I'm not mistaken, I think that was the word. Let me just clarify now. Government has already decided to create these corona health facilities in the state by the prefab construction, taking into consideration the urgency and the challenges that we have in the state. And I would like to inform you, Government of India through Donor Ministry has provided us 6.7 crores for creating such corona health facility in the state. And we decided 2 places will be establishing. One is in Shillong and the other one is in Tura. And the capacity of these 2 will be for 200 beds. 100 will be in Shillong and another 100 will be in Tura. So I just wanted to clarify this issue too. On behalf of the government, we are so thankful to all of you media, print, electronic. You are also treated as frontline workers of the government. But don't feel proud of it. And please give accurate information. But let me just tell you on record, we are so proud of all of you, and the government also recognizes all of you. You are also the frontline workers of the state.
The patient who is admitted in the hospital, serious patient, when they enter the ICU with ventilator support, the package per day is 4,900. Now we have worked out a formula that at least on the first day till the 6th day, this coverage will increase up to 60,000 rupees.
So all private hospitals, they have been notified that for COVID patients also and otherwise also, they inform the office and we do registration every day, even for COVID patients. We have a set database of eligible beneficiaries. This database has been created using the electoral roll of 2016 and then added on. Plus, we have the database of the socio-economic census. There are several families and people who are not in the database. So for those people, we usually collect the EPIC card and then it is sent to the central government to get their names added into the system.
What we saying is those who meet the eligibility criteria, it is open. They can easily get themselves registered.
In the database, there are about more than 7 lakh households in our database. But out of all those households, only approximately 4.4 lakh households have registered. So there are still 3.4 lakhs or 3 lakh plus households who are not registered but are there in our database, sir.
When the patient goes to the hospital, it is not that they go and say, I want to be registered as an MHIS patient. Okay, it does not work that way. They go to the hospital, they are treated, okay, they become well, and when the bill is presented to them, they want to be registered in the MHIS. It cannot be done like that. But if you go to the hospital authorities will ask first whether you have got the MHIS card or not. If you don't have, they will tell the relatives. If the patient is very sick, they will tell the relatives, go and register. So on the first day when you go and register yourself, that means you become a beneficiary from that first day. While if you go after the 5th day, you've already been treated, you're all right, and you register, you become a beneficiary from the 5th day. So you cannot say that for this past 5 days, that card should apply. That is the problem. What you're talking about, that is the problem. There are so many cases like that which have come forward. We cannot help because this is insurance. It works that way. And plus, this is the state insurance together with PMJOY. So it is not only the state alone from the MHIS team alone they can decide that. That has to be done. Otherwise, there is an audit. There is always a very strict audit on this, and we have to reply. That is the problem. For the past now, from March, we have gone for an intensive registration. We have gone to the villages, and we found that many are willing to come forward, okay, realizing the scheme. But there are still many who have to be covered. But because of the pandemic situation now, okay, we cannot go to the field. Once this situation improves, then we go to the field. People, like what you have said, I totally agree with you, that now they realize the benefit of this MHIS and they're coming forward. So we are very confident that from the next policy period onwards, when we go for an intensive drive again, people will come forward and register. Then we get more coverage.
In 2019, we had just merged with the PMJ scheme and it was dependent on internet connectivity. We did face that issue. However, sir, in this year 2021 onwards, we came with a solution of going offline, collecting the data from the beneficiaries and then putting it online when there is connectivity. We actually in fact started this procedure during this month of March, but because of COVID, we are currently in most areas cannot go and visit the villages currently.